New research showing that women are more than twice as likely to die after a heart attack than men. Researchers at the European Society of Cardiology looked at records of 844 patients. They found that 30 days after a heart attack, almost 12% of women had died, compared to almost 5% of men. And 5 years after a heart attack, 32% of women had died versus 17% of men. Researchers say the findings indicate a need for more research to close the gender gap when it comes to survival after a heart attack. Dr. Curry-Winchell joins us now to help us understand what's going on here. So, Doc, another study actually found that the diagnosis of heart failure is usually missed more often in women than in men. Help us understand, why is the diagnosis and treatment of heart problems more, I guess, adversely affecting women?
Well, this has unfortunately been happening for a long time. Often when we look at the traditional or classic types of symptoms with chest pain, we think of chest pain, arm pain. However, that is often associated with men. However, with women, there are unique symptoms such as fatigue, flu-like symptoms. And so often they're just misdiagnosed or correlated to something else. And that's, something that we have to continue to talk about because, as you mentioned, it's really costing lives every day.
So what sort of treatments or preventions are the authors of this study recommending for women after a heart attack?
So the important piece is to really not ignore those subtle symptoms, such as discomfort or anything that is not at your baseline. And so this study really highlights the importance of going in and seeing your doctor, as well as not allowing those symptoms that are often associated with either menopause or other factors to go ignored. So this study highlights that we have to be mindful and really look at the symptoms associated with heart disease and their effects for women.
Yeah, you have to pay attention to the warning signs. Dr. Curry-Winchell, we appreciate your expertise and sharing with us today. Thank you so much.